Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order and this is quite convenient for this study. Now let us discuss about the newborn care. In that we are discussing about Ayurvedic methods of newborn care, and today in that we are discussing about Nabhi Nala Chedana in detail. The most discussed part in the newborn care in Ayurveda is Nabhi Nala Chedana because different authors have given different explanations. So that created some confusion and that needs to be rectified. Now, cutting of the umbilical cord is a first procedure done immediately after the birth, irrespective of the normal baby or abnormal baby, that is sick baby, isn't it? So it may be a normal baby delivered, it may be a sick baby delivered, or baby sick at delivery. The first step is always you have to separate the baby and mother, or fetus and mother. Therefore, cutting of the umbilical cord is the main step. So this is the first step, irrespective of whatever may be the situation. First you have to cut the umbilical cord and separate the baby, and then baby will be given for a resuscitation or normal care. So therefore, care of the cord stump thereafter is equally important. Number one is cutting of the cord is important, first step. And thereafter, taking care of the stump, umbilical stump, is also equally important because that is one of the most vulnerable area for the infection. So Ayurveda explains this procedure in detail, which separate the baby from the mother and compels it to thrive independently. So actually cutting of the umbilical cord from where actually the early neonatal age starts, once you cut the umbilical cord. And this is an important event because this is the event which separates the baby and the mother, and this compel the baby to thrive independently. Okay, now what explanation is given by Charaka? Charaka told that it should be done immediately after prana pratyagamana, that is initiating the respiration. Now this is told by Charaka that Nabhi Nala Kartana should be done after doing prana pratyagamana, that is after initiating the respiration you have to go for Nabhi Nala Kartana. Once the baby is delivered, what he says, measure 8 angula length from the stump of the umbilicus. 8 angula length. Okay, so 8 angula length from the stump of the umbilicus, and make a point at 8 angula length. Then hold the free end of the umbilicus in between the two fingers, so that already made point will come in between the two fingers. Cut exactly at the point where the mark is made by Ardhadhara Shastra. And Ardhadhara Shastra is can be made out of gold, silver, iron, etc. Whatever it's left to you. An instrument should be sharp enough for the easy cutting, and also there should not be any rusting, etc. So these are the first time reading out all the explanation given by Charaka. The cut end should be tied with a ligature, okay, and then the thread should be encircled against the neck of the baby, so that the umbilical stump will be lifted up to prevent its contact with the fecal and urinary contents, which helps in prevention of contamination. So what Charaka says is, after cutting the umbilical cord by 8 angula length, you have to tie a ligature. You have to tie a ligature, and therefore thread should be kept along over the neck area, so that umbilical cord stump will get lifted up and it will not come in contact with the nearby perineal and as well as the anal area or the urinary area, so that it helps to prevent the contamination. Further, the cut end of the cord should be lifted so that oozing of the blood from the cord will be prevented. So what he says, why it has to be, the thread has to be encircled against on the neck. The reason is, as the cord will be lifted up, so it helps to prevent the oozing of the blood, isn't it? Leaking of the blood from the umbilicus is also one of the main problems if you are not doing this procedure properly. As a solution for that, Charaka says that you tie it around the neck of the baby. The thread should be tied around the neck of the baby, so that it also helps to prevent the contamination from the urinary and stool area. In the meantime, it also helps to prevent the oozing of the blood because it is upward directed. So after cutting, in the subsequent days, if suppose there is inflammation occurs, then the drugs mentioned below are used for avachurnana, it is sprinkling, parisheka, and the lepa should be done. Okay, avachurnana and parishekana and lepa should be done, and some of the taila and grita preparations are also applied. That is also mentioned. So this is, he says, the first part is cutting up the umbilical cord and taking care of its Second part is now taking care of the umbilical stump. So because of umbilical stump in the subsequent days undergo degeneration, it has to be separated. In the process, there may be umbilical sepsis or umbilical infection. In case if inflammation occurs, then you have to do the avachurnana, parisheka and lepa of the drugs like lodra, maduka, priyangu, devadaru and haridra, etc. Okay, so this is the total explanation given by Charaka with regard to Nabhi Nala Chedana. Now, there are some points, pitfalls here. Charaka says, first you cut the cord and then tie with the ligature. According to his explanation, first you have to make a point in between two fingers and then you have to cut. And after cutting, you have to ligate it and then you have to encircle it around the neck. But practically talking, this method is quite difficult. Okay, practically you first cut the umbilical cord and then you tie. So this is practically quite difficult as the umbilical cord is very slippery. And tying the cord after cutting at 8 angula length, which is very long. 8 angula means very long. In the present day practice, we only keep about 4 to 5 inches maximum length. But here it is 8 angula length, means it is too lengthy. Okay, which is long enough to, and maybe Charaka has thought that if you cut from a long distance, the blood which is present in the umbilical cords will be given back to the baby instead of a mother. That means you cut the umbilical cord by 8 angula length, which is a long distance, then you lift it up and then encircle it around the neck of the baby, so that whatever the blood which is present, maybe 10 ml or 15 ml or 5 ml, which is present in the cord, so that will be given to the baby, which is a quite important boost. Okay, because total blood amount which is present in the newborn baby is 80 ml per kg. If the baby is 2 kg, it contains 160 ml. From the umbilical cord, in the last minute, if you are pushing about 10 ml blood extra, so that is also a that means a boost to the baby. Okay, so this may be one important idea of cutting the umbilical cord so lengthy. Then drugs used in the case of infection, yes, maduka, lodra, priyangu, all the drugs are having anti-infective properties, and they are also having wound healing properties, and they are also having sravahara properties. Properties. So this is what is explained by Charaka, and probably this is one of the reasons. Now, Charaka's explanation of cutting the umbilical cord too lengthy, 8 angula length, which provides some extra amount of the blood to the baby, is quite beneficial when you are dealing with the low birth weight babies or preterm babies. Because preterm babies definitely have shortage of the blood here. Okay, they want some extra blood. So even today also, if the preterm baby is delivered, there is a method or a practice of delaying the cord cutting for about 10 seconds. Usually, if you know that it is a preterm baby, usually we will tell the Prasuti people, gynecologists, that madam, please wait for 10 seconds, and we start counting 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yes, cut. So now this 10 second, and if the baby has been kept below the level of the mother in the cot, that means just delivered baby has been placed just below the level of the mother, and allow 10 seconds. So this will provide the extra amount of the blood which is present in the placenta to come to the baby, which is a very good boost as far as preterm and as well as low birth weight babies are concerned. So this practice is even today we are practicing. So probably Charaka, when he says 8 angular length cord has to be cut and then it has to be encircled around the neck area of the baby, neck of the baby. So he is mean to say that the blood which is present in the umbilical column, okay, after cutting 8 angular length means it's a quite good, quite remarkable length, and so that particular blood will be given back to the baby, and therefore Charaka might have been dealing with either low birth weight babies or preterm babies. Okay. Now, complications of the improper cutting is also mentioned by Charaka. Charaka also mentioned the complications of improper cutting of the umbilical cord. If you cut the umbilical cord in a wrong way, what are the possibilities? Therefore, he explains about mainly 6 complications. Asamyak nabhi nala kartanajanya rogas. They are also called as asamyak nabhi nala kartanajanya rogas. He mentioned about 6 important complications like ayama, vyayama, uthundika, pindalika, vinamika and vijramika. That we will discuss in the later class, but these are the 6 complications mentioned by Charaka. Now same, talking about Nabi Nalakartana mentioned by Sushruta. So what he says, according to him, Nabi Nalakartana should be done after Pichudharana. First you cover the baby, maintain the temperature, take care of the anterofrontal, and then you go for Nabi Nalakartana. This is what Sushruta says. Now first 8 angulas are measured from the umbilical stump and make a point, and both the ends of the points, and then cut with the clean sharp instrument. A sutra should be encircled around the neck of the baby, and this is to prevent oozing of the blood or srava pariharartha, and also to prevent the fecal contamination of the cord. Then what Sushruta says is, cut end of the cord should be irrigated by a kushta tela. This is not mentioned by Charaka, but Sushruta says that you have to irrigate it by kushta tela. Then baby is stabilized. Okay, and this is the method of Nabi Nalakartana mentioned by Sushruta. He also says that 8 angular length has to be taken, but only difference is Charaka says first you cut and then you tie, but whereas Sushruta says first you tie and then you cut. Okay, so this what we are presently practicing. First we will cut, first we will tie the knot and then we will go into cut. So this is quite helpful. Okay, of course nowadays we are using the arterial forceps to clamp this, and later onwards when we are trimming it, so first we will tie the umbilical cord clamper and then we will cut it. So same explanation is also given by Sushruta, which looks more practical than Charaka. Okay. Similarly, in this aspect, what Vagbhata explained is something different. Vagbhata says that cord should be cut by 4 angula length. Now this is very important. Now cutting of the cord should be done once the baby is stabilized, first he says, and once the baby is get stabilized, swasti bhutasya balasya, once the baby is get stabilized, then you have to go for cutting of the umbilical cord, and according to him, you have to cut by 4 angula length by using a sharp instrument after tying with a cotton thread, and then you encircle it around the neck. Vagbhata used the word Nabhi Vardhana. Okay, for the Nabhi Nalakartana, he used the word Nabhi Vardhana also. Nabhi Vardhana. Then again he says that cut hand should be applied with the kushta tela. Then dried cord usually falls on the 5th day, and after falling it leaves back an ulcer or a wound at the stump area, which should be applied with the charcoal powder and the jaggery water. So this is explained by Vagbhata. So charcoal powder may be useful to prevent the sravas. It absorbs the srava and makes the area dry. And jaggery water is basically, jaggery is a sandhaniya drug, maybe for proper healing they may be using this jaggery. Now let us have the comments on this. Different authors mention different measurements. Charaka, Sushruta, Vagbhata mention different measurements, isn't it? So 8 angulas by Charaka, 8 angula by Sushruta, and 4 angula by Vagbhata, which may be due to the different situations that they are facing during the baby camp. They are not specified it. Okay. Now we know that there are some indications of early and late cutting of the umbilical cord in the present day practice also. One I have already explained. Indication for the late cutting is especially in preterm babies or in antenatal hemorrhages, anemia, etc. So that extra amount of the blood can be given to the baby. So therefore the 8 angula length might have been selected so that extra amount of blood can be given to the baby. Early indications for cutting the baby early, that means no more blood should be come from the placenta to the baby. If it comes, it is dangerous. That is in case of RH incapability and polycythemia vera, etc. So both are there. So 8 angular length, when he says, definitely it may have some logic. So he is intended to provide extra amount of the blood to the baby. Okay, as already we will have in the present practice also early cutting and late cord cutting practices. 4 angular length which is mentioned, definitely it is for the normal baby. 4 angular baby, 4 angular length of a cord has to be cut. This is most suitable for the normal babies. So idea of this is to now. Hence this portion we have already explained. Tying the thread over the neck of the baby is a very practical method to prevent the bleeding from the cord in case of cord clamp or ligature is displaced. Okay, when you do the cord clamping and leave it, there is every chance that it may be get loosened or displaced. But this is the safest method if you tie it around the neck so that umbilical cord is facing upwards. So this is also good to prevent the infection of the cord by the fecal and urinary contact. And one more thing is, by this method, if you cut the cord longer, cord cleaning is also quite easier, because as the day passes, cord gets shrunken. It becomes very small. So when it is small and tight, actually lifting the cord and cleaning the umbilical cord is quite difficult. But if it is long enough, then it is quite easy, maybe. Now, other thing is Ardhadhara Shastra is used. Ardhadhara Shastra means one end is very sharp, another one is blunt. So as far as the slippery nature of the umbilical cord is concerned, this Shastra is a more usage of this Shastra is more practical. Nowadays also we are using umbilical cord cutter, so that is also having the same structure. Ardhadhara, one end is blind or not sharp, another end is very sharp. Shushruta's explanation is more practical, while Charaka's opinion lags behind to fulfill the present day opinion. We don't know that Charaka is maybe dealing with some special babies. He may be dealing with the sick babies. We don't know that. Different authors mentioned Nala Kartana at the different levels without uniformity, which may be due to the fact that they have lived in a different time period. This shows the modification done in Navajata Shishu Paricharya from time to time to overcome the practical difficulties. So this is evidenced by Vagbhata's explanation, the latest Samhita Vagbhata, so where the order is more or less equal to Navajata Shishu Paricharya, what we are practicing nowadays. So this much of explanation is available about the Nabhi Nala Kartana. The rest of the things in Ayurveda newborn care we will continue in the next class. Thank you very much.